10 years ago I retired, and I'm pretty much golf and beach. And grandkids. Golf, beach, grandkids are kind of the activities in my life. I was diagnosed with a meningioma, which is the most common brain tumor, about 5 years ago. I actually went to the doctor to get my sinuses checked. And he sent me to an ear, nose, and throat guy who said, oh, let's go get an MRI. I went and got an MRI, and I went back to him, and he said, you may not want to worry about your sinuses, you may want to worry about your brain tumor. And that started the cycle of fear and whatever. I went back to my general practitioner, talked about who I should see about a brain tumor. So we started monitoring, and every 6 months I get an MRI. And usually the wording that comes out of the MRI is minimal growth, slight growth, nothing to be concerned with, until last July, when I got my annual MRI, and they said to me, it's been 5 years and now we've grown about 5 millimeters, which isn't that big, it's a ½ an inch, but you add that onto a golf ball and it's, gotten bigger, and it started approaching my optic nerve, and he said it's time to do something. So obviously, he was the brain surgeon, he talked to me about surgery, but he said, you may want to explore radiation. First off, I was scared to death of surgery. Part of me wanted to have the surgery and just be done with it, get this thing out of my head and kind of not have to worry about it anymore. But when I sat down again with my general practitioner, and he said, Tom, do you really want to go through surgery? I said, Doc, I'm not. I really don't, I'm scared of it. So he said, let's try this first. So then I saw Dr. Lee here at the center, and he explained the proton therapy to me. And that's kind of brought me up to the fall of last year, when I actually chose the proton therapy as my course of treatment. And the treatment was to stop the tumor from growing. Since proton therapy, I feel fine. Fortunately for me, I'd never really had any symptoms of the brain tumor. It was found accidentally, but I had no residual effects from the treatment. I had some skin irritation and some fatigue, but kept my hair. But physically, I feel fine. I'm back to playing golf, back chasing the grandkids around, and all of that good stuff. So I call them the ProCure Angels. Every time I came here, from Sal at the desk, to the nurses, to the crazy millennials that run the equipment, they just knew how to handle people, and they were so professional. And although I had to come here every night at 7:20 for 6 straight weeks, I actually started looking forward to it. They work hard at being human in tough situations. But the thing I really think is you got to keep your sense of humor.